There is another COVID-19 vaccine now being used by the Milwaukee Health Department, the Novavax vaccine. Joining us to talk about it is Dr. Bill Hartman, principal investigator for the UW Health pediatric Moderna vaccine trial. All right, let's start right off the top. What makes Novavax different from the others, and why is this just becoming available to the masses now?
So Novavax is an entirely different platform than Pfizer or Moderna or even Johnson & Johnson. Pfizer and Moderna, as everyone knows, are mRNA vaccines. This Novavax is a more traditional vaccine, similar to what we've had since we were young kids. It's protein-based, so rather than giving a genetic code to make the spike protein, it has a synthesized spike protein already in the vaccine that gets injected and you develop antibodies to it. And so, like I said, it's a more traditional vaccine. They really feel that it's going to fill a niche that wasn't here for people who wanted a vaccine but didn't want one of these newer technology vaccines.
Makes sense. And now it's available for all at the Milwaukee Health Department if you're interested in that. You know, so many of us have used those COVID rapid tests that you can get right over the counter. Research, though, is now showing that that may not be as effective at detecting Omicron variants.
Right, and especially early in disease, the antigen tests will give you a false sense of security coming up negative. The FDA now has issued some new guidance where they think that it's best to do serial testing, especially if you have symptoms and you had a negative test, or if you've been exposed to a person who is COVID positive and you have a negative test. So within the next 5 days or whatever, you should probably serial test. So you have to have more than one of these antigen tests in your home.
So don't just trust the first negative that you might get.
Right.
Well, speaking of those symptoms, are you seeing any more specific symptoms with this most recent wave with the BA.2 variant in comparison to past waves?
So with a lot of the Omicron symptoms, they've been somewhat similar, kind of from the throat to the tip of the nose. And so you will see quite a bit of nasal congestion, definitely a lot of sore throat. That seems to be the number one thing that people have complained about with these BA.5 variants. Is it being a very, very sore throat. And so treating that with any of the over-the-counter lozenges, Tylenol, things like that to help cut down the inflammation. Staying hydrated is very important. These are things that can really help these symptoms that people are having.
Good to know. Good to know. Well, Dr. Bill Hartman, we always appreciate picking your brain on this sort of thing. So we appreciate your time as always. Thanks.
Thank you.
Great.